Hi, everyone. My name is Dr. Stephanie Saucier, and I treat patients with heart failure every day. So today we're going to be making a video about what heart failure medications are important that your doctor may prescribe and why they're important for you. So let's get started because taking your heart failure medications can help you live a longer, happier life. So it's important to recognize that if you're diagnosed with heart failure with reduced ejection fraction, where your ejection fraction is less than 40%, your doctors want to put you on at least 4 medications. These are the 4 pillars of heart failure with reduced ejection fraction medications. And collectively, these medications help you live longer and help you feel better. There might be an extra one as well if you need it, and that's a diuretic, but we'll get into it in a couple minutes. The first pillar are beta blockers. Beta blockers, there's 3 approved beta blockers. They're called carvedilol or Coreg, bisoprolol, or metoprolol. Those are the 3 beta blockers that we use to help with cardiac remodeling. They help make sure that the heart pumps more effectively and more efficiently, and they've been shown to decrease mortality in patients who have heart failure with reduced ejection fraction. So your first pillar is your beta blocker. Your second pillar, or the second medication that's going to be prescribed, is something that is a renin-angiotensin system inhibitor. So this can either be an ACE, an ARB, or something called an ARNI. ACEs are things like lisinopril or enalapril. ARBs are things like losartan. And ARNI, there's only one ARNI out there, and that's called Entresto. These medications have been shown to improve mortality, decrease hospitalization for heart failure exacerbation, and ultimately, again, help you live longer. They also help with decongestion, keeping the fluid moving so that you don't start to build up with additional fluid. The third pillar for heart failure medications is something called an SGLT2. These are newer medications, but have been found to really help and protect patients from heart failure hospitalization and mortality, whether you have diabetes or not. These medications are called Jardiance or Farxiga. And again, they're going to be helpful to help protect you from heart failure exacerbations, collection of fluid, and overall mortality. Your fourth pillar are your mineralocorticoid receptor antagonists, or MRAs. These medications are things like spironolactone or eplerenone, and they're the fourth pillar to really help protect you from a cardiovascular standpoint. Sometimes it can be overwhelming that your doctor is going to put you on 4 medications right off the bat, but it's important that you take all 4 of these medications and work with your doctor to make sure that you're able to get on all of them, because what we see in the research is that people who are able to get on all 4 of these heart failure medications for reduced ejection fraction live longer. That 5th and bonus medication that's not necessarily part of the pillars, but is often used in heart failure with reduced ejection fraction is a medication that's a diuretic. We often use things such as Lasix or torsemide. These are pills that will help you decongest and just urinate out that extra fluid that you may build up over time. Sometimes we use these diuretics in the inpatient setting or in an infusion clinic, and your doctor will instruct you if and when you're someone who would need a diuretic. So it's important that once you're diagnosed with heart failure with reduced ejection fraction, you know that these are lifelong medications. We know that patients who come off of these medications actually have a higher risk of having recurrence of heart failure and worsening of symptoms and outcomes. We also know that patients, like I mentioned before, if you're on the maximal tolerated dose of all 4 of these medications, you'll live longer. When we get your medications just right, you'll notice improvements in energy, breathing, and your daily activities. Hopefully, you'll stay out of the hospital, and many patients find that they can enjoy life more fully, managing their heart failure with confidence and also stability. So it's really important that if you're someone who's recently diagnosed, that you're taking all of these medications, asking your doctor about them, and if you're having side effects, talk to us so that we can adjust and try to use other medication. If you like this video and want to learn more, please like and subscribe. There's also the free heart health guide, which you can download by clicking below.